Hey guys, it's Kelly from Power and Motion Rehab. So today we're going to go over 5 exercises to really focus on strengthening that quadricep muscle. Maybe you're here because you had a stroke in the past 6 months. Maybe you're even further down the road. Maybe it's been up to a year, but you're still kind of feeling a little bit weak in that knee. Maybe you're finding difficulty going upstairs, getting out of a low surface like a couch. Maybe you're having trouble just walking in general. And where you're feeling that weakness is maybe in your knee. So we're going to hone in on the quadricep muscle today with the 5 exercises that I've already mentioned. So if you have had a stroke in the past, maybe, you might be that patient that you had substantial weakness at the beginning. Maybe your knee was buckling. So the physical therapist, occupational therapist, whoever that was working with you had to block that knee. Maybe you've gotten to that point where you're using a walker and a cane, or maybe nothing, but you're still feeling a little uneasy because that knee just feels like, oh, it's not quite there yet. I'm still feeling like I can't squat. I can't go upstairs really as well as I want to. So these exercises are more geared towards you. Maybe you've progressed to the point where, yeah, you're walking a little bit better, but you're just not trusting that knee as much as you want to. So let's go ahead and get into those quad strengthening exercises. All right, so the first exercise we're going to go over, I'm sure you've done these 1,000 times, just kind of a sit to stand, a version of it. So in this example, we're going to pretend like my left leg is the good leg and the right side is the weaker leg. So this means I might have had my right leg is the affected side from the previous stroke, okay? So again, my right side's the weaker leg. So if this is my weaker leg and my goal is to strengthen this, and this is mostly for your patients, for you out there, where you're getting up and down from the chair okay, but again, we just want to really hone in on strengthen. So if you're requiring a physical assistance, maybe this isn't, maybe you're not quite there, or if you're having trouble with like both legs to get up, don't do this yet. This is for those of you out there that are able to get up from a chair, but you're just not strong on one side. All right, so again, my right leg is the affected leg from the stroke, and what we want to focus on is strengthening. Okay, so what I'm going to do is I'm going to bring this leg back, okay, closer to my body. Usually we teach you to have a fairly balance your weight from both legs to stand up, right? But here, because we're strengthening, we're going to get this leg back and we're going to put this leg forward. So I'm even going to put it off the screen here. So you're going to, so most of my weight, let's say it's almost 75 to 80%, is going to be coming from this leg. You can use your hands if you need to, just to like have that little tactile balance and cue to push up on. But ideally, because we're strengthening our legs, we want to use our legs. So again, the leg that's weaker and that you want to strengthen, get that underneath you more, take this one out. Because this is more just for balance. We're not really pushing too much up from this. So I'll do a set of 3 here, okay? Without my hands, get to the edge, and I'm pushing down through my leg I want to strengthen. And we'll just push up because we're stacking our weight over that leg. Up. And then if you want to make it easy, you can balance it back or bring your leg back to make sure you're sitting with both legs. But honing in on that one leg, I'm not using too much momentum. And